lecture series on
أعوذ بالله
infection.
السميع العليم من الشيطان الرجيم وبه نستعين. Good afternoon, our viewers. Welcome to our platform of Islam, Health and Lifestyle. Today, inshallah subhanahu wa ta'ala, we are going to discuss a very important and interesting topic which has bothered a lot, which in any sitting of 2 to 3 women, the topic of discussion is infection. You see them complaining infection. And that is why today we can see a lot of vendors all selling infection drugs, taking advantage of this complaint of the people. But always, as Muslims, we look at everything in the light of Quran, Sunnah, and modern science. As we said, a sound knowledge never contradict Islam. Islam is always welcoming knowledge. Allah subhanahu wa ta'ala, looking at the issue of STI, that is sexual and transmitted disease, according to WHO, that daily there are more than 1 million cases of sexual transmitted disease daily. And yearly, we have more than 499 million curable STIs globally. If not informed, we know this has reached the stage of epidemic, and that is what we call waba in Arabic. WHO estimated that yearly we are having 10.6 million cases of syphilis and 106 cases of gonorrhea. Today, you look, WHO give a lot of solutions. Protective sex, using condom, but yet these diseases are increasing. And we deem it fit that why not we turn to the divine situation? Why not we give attention to the glorious Quran? What did the glorious Quran said? Because of the gravity of zina, adultery, or fornication, Allah subhanahu wa ta'ala never said in the Quran, never do or never occur or never indulge in sex. No. Allah subhanahu wa ta'ala never said, la taf'alu zina. He said, la taqrabu zina. Ay la taqrabu al-wasa'il al-wusul ila zina. Meaning, do not approach the ways that can lead you to zina because of the gravity of zina. Allah subhanahu wa ta'ala, why? Innahu kana fa'ishatan wa maqtan wa sa'a sabila. And Rasul sallallahu alaihi wasallam has informed us. He said, the son of a man has his portion from zina. Kutiba ibn Adam hazwu min az-zina. Al-aynu tazni wa zina an-nadhar. Prophet sallallahu alaihi wasallam said, the son of man has his portion for zina. Prophet sallallahu alaihi wasallam said, the eyes is fornicating, and the fornication of the eyes is looking. And we can see with the advent of social media, even the rise of fornication, porns, and other things have increased. We can see the manners we see in Facebook, especially TikToks. We can see what is happening. Indecencies, moral decadence. All these are source of increase in zina. But today, the world never speak about that because the world is benefiting from that. And this is one. Secondly, when we look at the hadith of Rasul sallallahu alayhi wasallam, the hadith of Imam Ahmad, Imam Nisai, Ibn Dawood, the hadith of Abdullah bin Umar, the wonderful hadith that we need to give attention to. He said, أقبل علينا رسول الله صلى الله عليه وسلم فقال يا معشر المهاجرين خمس إذا ابتلبتم بهن وأعوذ بالله أن تدركهن ما فيش الفاحشة في قوم قط حتى أعلنوا بها إلا فشى فيهم طاعون وأوجاع التي لم تكن في أسلافهم الذين مضوا وما نكسوا المكيال والميزان إلا أخذوا بالسنين وشدة المعونة وجورة السلطان عليهم وما منعوا زكاة أموالهم إلا منعوا قطر من السماء ولولا البهائم لم يمطروا وما نكثوا عهد الله وعهد رسوله إلا سلط الله عليهم عدو من غير أنفسهم فأخذ بعد ما في أيديهم ومن لم تحكم أئمتهم بكتاب الله ويتخيرون فيما بينهم إلا جعل الله بأسهم بينهم شديد. What a wonderful hadith. Abdullah bin Abdullah bin Abbas said, Prophet sallallahu alayhi wasallam turned unto us. He said, oh, you the assembly of Muhajirin. He said 5 things, 5 afflictions, 5 diseases, 5 calamities. I beseech Allah subhanahu wa ta'ala, they should not befall you. He said fornication, adultery will not be widespread in the society until it has been advertised, except Allah subhanahu wa ta'ala descend elements, diseases, epidemics, outbreak, which our parents, our pious predecessors, our forefathers never knew. And today we can see from this disease to another disease, yet we have not taken a lesson from what Rasulullah said. There is also another narration of Ibn Majah where Prophet ﷺ said, Mazar al-Faishatu fi qawmin illa sallallahu alayhim al-maut. Sheikh Nasruddin Albani has authenticated this in Silsilat Hadith Sahihah. Prophet ﷺ said, fornication will not be widespread in people except Allah subhanahu wa ta'ala will cause deaths. And we can see the dead the way they are tolling. And we feel there are some problem, but this is the genesis. So we have to be very careful. In general, when we look at STI, or we said infection, we can broadly categorize it into 2, the first generation infection and the second generation infection. The first generation infection are the like of syphilis, gonorrhea, Herpes simplex virus, human papilloma virus, HIV, So we will not dwell much on this because these strictly, they are more contacted through zina, though mostly medically we speak about other contact with infected needles and other, but if we look at the statistics, it's very rare. This disease is caused by illicit sexual intercourse. So the best thing for us is abstinence from illicit sexual intercourse and encourage marriage. And this is what I advise the WHO to do, but not even those solutions we are given. They are not going to solve the problem, and that is why the problem is not declining. The solution is to abstain away from zina. Zina brings Allah subhanahu wa ta'ala out, and that is why we are seeing these diseases every day. They are increasing, they are tolling year by year, day by day, minute by minute. We pray may Allah subhanahu wa ta'ala guide us. We pray may Allah subhanahu wa ta'ala protect us. The next aspect is the STI. The next aspect of the STI is second generation infection, and this is vulvovaginitis. And this is the one we are going to give attention, and this is the one that affects our people more, and this is the one our people are complaining about almost. Today we can see people are saying toilet infection, people give different name. In medicine, medically, there is nothing called toilet infection. But when we look at the Islamic jurisprudence, the usul of Islam, we said al-ibrati bil ma'ani la bi alfaz. What matters is the meaning, not the word. So there's nothing wrong for people to get words that will easily express a concept they want to express. There's no problem about that. But the most important thing, let's understand what is STI. I believe before we furthermore, we even need to understand the female and the male genital system or reproductive system, which mostly these diseases, those are the area they are affected. In Arabic we say al-jahaz at-tanasuli al-unthi wal-jahaz tanasuli al-dhukri. Then we say al-jahaz al-bawl. So these are the two systems. Now, starting from the urinary system starts from the two kidneys, the left and right kidney, then the ureter, then the bladder, then the urethra. This is just the urinary system, and they are what? Anterior when we look at it anatomically. Then the female reproductive system starts from the two ovary, the tube, the uterus, that is the endometrium, the inside the uterus, cervix, vagina, vulva. That is it. And it's very important we understand this concept. Today you see many people scanning, especially the unprofessional scanners. You see many times they will say PID, PID, PID. What is this PID? Many times the issue is just vulvovaginitis, but they'll say PID. So it's nice we understand PID is a spectrum. That is oophoritis, that is the infection of the two ovaries. Salpingitis, the infection of the two tubes. Endometritis, the infection of the lining of the uterus. Cervicasitis, the infection of the cervicasitis. Vulvitis, vulvovaginitis. So that is it. And even when we look at it embryogenically, even the origin of the creation is not the same. But we are not going to dwell into that because our viewer, we don't want to dip into embryology more. So this is it. Now, after knowing this, the most important thing, what are the risk factors of infection? Today you see many keep on treating this infection without even knowing what are the risk factors. These risk factors of this STI, as I said, the STI now we're talking about vulvovaginitis. Now, the risk factor, we can broadly divide it into two, the modifiable and the non-modifiable. Now, let's start with the non-modifiable. When we say non-modifiable, these are realities that you cannot change them. One is puberty, the attainment of a puberty of a female child. Because we know when a woman is being created, all her primary and secondary sexual characteristics will not start functioning except the day she starts menstruating. That is the day that our ovaries has started functioning. That day, if at all she's going to have a sexual intercourse with a healthy sperm, she's going to get pregnant. So, how did puberty causes STI? You see, preparing the pelvic or preparing the woman for menses, we have two hormones that have effect on that. One, estrogen, then we have the prostaglandin, all are going to increase. So you get the point. So she's going to experience what we call hyperestrogenism, meaning the estrogen is going to be high. This is going to cause the pelvic vessels to be engorged, meaning they're going to swollen. And that swelling is going to create a little changes in the fluidity of the pelvic cavity, meaning they're going to have a water collection, which is another effect of estrogen. So they're going to be water collection. This water collection now is also going to dilute the nature of the private part of the woman, which naturally is acidic, in opposite to the uterus. Inside the uterus is alkaline. And we're going to discuss where Allah subhanahu wa ta'ala created this wonderful system. So that alone is going to give opportunity to the organisms that may not thrive, and they are going to thrive. And looking at the blood being an alkaline solution, the blood is alkaline, and the vaginal system is acidic. The medium is acidic. So as the blood goes in, it dilutes the acidity, and normally we know, and this is another second point, which is very important. This is science now. The second point is now when you have the reaction between acid and base, you're going to have a salt and water. So you see, even water is going to increase, and that is going to reduce the acidity. This will give chance to the opportunistic infection. Then they will take chance and cause infection. Up to now, we're still talking about what? STI that has to do with vulvovaginitis. This can occur as a result of sexual intercourse and even non-sexual intercourse, as we're going to discuss. So this is number one. Number two, pregnancy. Pregnancy predisposes woman to infection. How? So there's one important thing about pregnancy that we need to know. Pregnancy protects the upper genital tract infection. A woman with pregnancy will not have PID, because what happens when a woman is pregnant, the cervical plug is going to close the cervix. And we shouldn't forget that the cervical plug is bactericidal. It prevents ascending of any infection into the uterus. And that is why many times, especially in the case of premature rupture of membrane, early premature, that is preterm, that is preterm premature rupture of membrane, and that is why you see that what we fear more is chorioamnitis, because the pelvic plug is out, meaning there can be chance that ascending infection will ascend up to go and cause infection to the amnion or to the chorium, and which is very dangerous, which is going to affect the baby. And that's why we're very concerned about that. You can see, so pregnancy gives protection to the upper female genital tract infection. Then the lower, because of the effect of progesterone, and among characteristics of progesterone is what? Smooth muscle relaxation, which is also has fluid retention. And that is why you see many women, if they are pregnant, they increase in weight. This is as a result of what do we call it? Effect of progesterone and effect of also growth hormone. You get the point? So the effect of the growth hormone, because of the water retention, the aldosterone system is going to also be reactivated. There's going to be retain of water, and that is why we see they're having edema all over their body, especially the pedal edema, because the oncotic pressure is going down, hydrostatic pressure is going up. She is going to have edema of the lower extreme, but the body fluidity is going to increase, the renal blood flow is going to increase, GFR is going to increase, so this is very important. I don't want to dip into more. So this is it. Then another important thing that has to do with that. Now we are a bit finished. Also, that's what we call senile vulvovaginitis. Senile. When we say senile, that means we mean age, because due to the unopposed and due to the lack of effect of estrogen, many of our menopausal women are going to have what we call vaginal dryness. And that vaginal dryness is going to affect the endothelium of the vagina. A lot of defense mechanism, we know many of the antibodies, they are in the endothelium. When activated, and that is when they come to the system, they are going to be affected, and this will predispose woman to infection. This is what we call in Arabic jufuf, and some women that have hypoandrogenism, you can see even some young women complain about that they're having vaginal dryness during sexual intercourse, they're having painful sexual intercourse, what we call dyspareunia. So that is it. So apart from this, another important thing is people, this has to do with both female and male, people that are long use of antibiotic. Long use of what? Antibiotic, or wrong use of antibiotic. This is very important. Antibiotic should not be used for a long time, because antibiotic is going to kill the antigen. At the end of the day, it's also going to affect the body antibody that will also bring down the immunity, and that will give chance to the infection organism to colonize the the vulva, and that will also lead to infection. This is one. Secondly, many people, what we see today, wrong use of antibiotic. For instance, now upper respiratory tract infection, counting from pneumonia, bronchitis, the best drugs for them are cephalosporin, the lack of cefixime, ceforaxime, augmentin, But you see somebody, especially more the chemist people, are very unfortunate, even some people that are not well attuned to what they're doing. You can see somebody will take a Cipro, giving it to somebody that is having what? Pneumonia, which is not possible. Cipro cannot cross the ligament of teres. It cannot cross. It's just below the limit. It has to do with abdomen, UTI, tissue, bones, and other things, but it can't go to the chest. So this will create a resistance for Cipro. And next time when someone is having STI, you will be given Cipro and it's not going to work. And this is also going to assist to weaken the immunity. Another important thing is people that are diabetic. Because the diabetic people, they have what we call lazy leukocyte syndrome. When an antigen now invade the system, we have the engulfment system. We have what we call interleukin. We have what we call migration. The interleukin, they will come, they will add the hidden molecules. They are going to phagocyte those that antigen. They're going to eat it up. So the mobilization of this leukocyte to come, that is the neutrophil, to come and attack. Those people with diabetic, they have weakness in the mobilization. Before they come, the disease is going to affect, and this also predisposes them to have low immunity. And we can see the reason from this, and this is why the diabetic patient, when they have problem, they have difficulty in healing of their diseases. So another important thing is chemotherapy. The chemotherapy weakens the immune system, because as it's killing the cancer cells, it's also killing the healthy cells. And that's why we can see a lot of complications with chemotherapy, alopecia, skin excoration, immune suppression, So this also predisposes them to infection. Another important thing is long use of contraceptive pills, either the pills or this, and we know the contraceptive is either estrogen, progesterone. So this also increase what's the body fluid retention, just as we explained before, and this also lower the immunity, and that is why you see many of them have infection, especially the people that are on loop. You get the point. So they have recurrent infection. So another important thing is using of antiseptic in washing the vagina. The vagina has an isotonic solution that cleans it every time. Sodium bicarbonate, Allah subhanahu wa ta'ala has created it, it washes it. So you don't need to use these chemicals, Dettol. So that also affects the environment of the vagina. It erodes it, thereby decreasing the defense system, the defense system that is what in the telial layers of the vagina, and at the end of the day, it's predisposed. We have what women do, what we call douching. Douching also affects this. And also another important thing is hygiene. Prompt shaving, using undies that of cotton and have a net in the front. You see, that net that women sees in their panties, it's not just for fashion, it's for ventilation, because when you sweat and you are hairy, you didn't shave, the sweating has sulfur in it, also is going to distort the acidity medium of the vagina, and this gives a chance for infection to occur. We are going to stop here. The other time we are going to have opportunity to continue. We are going to continue on what are the causes of this infection, what are the risk factors, how are we going to prevent our body, ourselves from infection. Meet you in our next episode. We pray may Allah subhanahu wa ta'ala bless you. Once again, I'm your own doctor, Dr. Abubakar Muhammad Abdullahi, the MD of King Kino Specialist Hospital, and the CEO, Abu Faza Balance Cure, the system that has medical, orthodox, and naturopathy and Islamic medicine in collaboration. We pray may Allah subhanahu wa ta'ala bless you. God bless you. Assalamu alaikum wa rahmatullahi wa barakatuh.